Welcome to Mastering the ECG, your complete guide to understanding and interpreting electrocardiograms. From basic waveforms to advanced clinical patterns, this series will teach you everything you need to know about reading ECGs with confidence. This is a 10-part series. This is part 6. And by the way, only a small part of our viewers are currently subscribed. If you're finding this content helpful, consider subscribing. It really helps our channel and ensures you won't miss out on the next video. Thanks for your support. When the oxygen supply is reduced, the myocardium goes through 3 stages. 1 is ischemia. The metabolic demand exceeds oxygen supply. 2. Injury. Cell membrane instability. Electrical current altered. And 3. Infarction. Cell death and scar formation. These stages can be identified electrically on the ECG before biochemical markers even rise. ST elevation occurs when injured myocardial cells remain depolarized longer than healthy tissue. Key STEMI criteria are ST elevation in more than 2 contiguous leads, more than 1 mm in limb leads, and more than 2 mm elevations in lead V1 to V6, and it must be new or dynamic. A STEMI is defined as any ST elevation. Consider benign early repolarization, pericarditis, or left bundle branch block. ST depressions often reflect subendocardial ischemia, but may also be reciprocal to ST elevations elsewhere. Typical causes are a non-STEMI, unstable angina pectoris, or posterior infarction, which will show ST depressions in V1 to V3. If you see ST depression in anterior leads and suspect posterior infarction, look for tall R waves and upright T waves, then confirm it with the posterior leads. T wave inversions can signal an ischemia, especially in leads V2 to V6, reperfusion phase of STEMI, persistent changes after a myocardial infarct, and a hyperacute T waves are a tall, wide, and asymmetrical, very early STEMI sign, and it's often overlooked. Always compare bilaterally and with baseline ECGs. Q waves indicate transmural infarction, usually hours to days after symptoms onset. Criteria for pathological Q waves are 0.04 seconds wide, which is one small box, 25% of R wave amplitude, present in more than 2 contiguous leads, and it's not normal in leads 3, AVR, or V1. A single Q wave in isolation is an old myocardial infarct. Context is the key. If we would localize the region of the infarction by lead groups, we will have inferior in leads 2, 3, and AVF, and the artery is typically the RCA or LCX. Anterior is shown in leads V1 to V4, and the artery is the LAD. Lateral is in lead 1, AVL, and V5 and V6, and the artery is the LCX. Posterior infarction is V7 to V9 or reciprocal V1 to V3, and it's the RCA. A high lateral infarction is shown on leads 1 and AVL, and the artery is in diagonal of LAD and LCX. And then you have the right ventricle infarction, which is shown on lead V3 and V4, and the artery is the RCA. Infarct territory often correlates with a culprit vessel, guiding emergent angiography. A myocardial infarction has an electrocardiographic timeline. In minutes, you will have hyperacute T waves. In 30 to 60 minutes, you will have ST elevation. In some hours, you will have Q wave developments. And in days, you will have T wave inversions. In weeks, there will be a normalization of persistent Q waves. Serial ECGs are vital, and ECG is a snapshot. Trends will tell you the real story. Not all infarctions are obvious. Patients with left bundle branch blocks or paced rhythms may need Scarbosa criteria. Isolated posterior infarction may only show ST depressions anteriorly. Whelan syndrome, deep symmetrical T inversions in V2 and V3, and the winter pattern upsloping ST depression pulsatile T waves in precordials. These are STEMI equivalents and should not be missed. Recognizing ischemia and infarction requires a trained eye and a clinical mindset. Always ask, do the ECG findings match the patient? Is it stable, evolving, or high risk? In the next episode, we'll examine ECGs in special conditions, from hyperkalemia to pulmonary embolism. Thank you for watching, and we'll see you next time.